Hi everybody, welcome back to my channel. This is my life in scrubs, and I'm Stacy. I'm a registered nurse. I have been in healthcare for 28 years, and I just thought there was some value in sharing some of those stories, tips, and tricks over the time if anybody would want to know. If I get to tell one person and help one person or give one person insight, then I guess that's enough for me. Um, Last time I talked about my journey into being an RN and into hospice. So I have been a hospice nurse for about 4 years now, and that's not a long time, but I can tell you I've learned a lot in those 4 years. When I got into hospice, I had no clue. I didn't know about pain management at all. Now, I will say to you that when I worked in long term care, hospice nurses would come and give us education about pain. And so I had a great respect for that, and I learned a lot about it. And I was used to administering hospice meds and seeing the orders for what we would give. But as far as like looking at a patient and knowing what they might need, and knowing how I can best help them is not something that I knew when I first started hospice. I had no idea, and I trained for a long time when I first started as a hospice nurse and wasn't on my own initially because I didn't know. I had so many questions. I probably just irritated my managers because I called constantly asking questions. I needed a lot of guidance when I started in hospice. Now, I will tell you that because I worked in long term care, I didn't have any hangups about using morphine for patients or misunderstanding about how that would help. But I've learned a lot about how morphine helps, and I've had a lot of education since becoming a hospice nurse about the medications that we use and the treatments that we use, and all the team members that work together to collaborate on a patient's care when they are at end of life. Um, I didn't know if I really wanted to stay in hospice when I started because I didn't know how to answer the questions sometimes. I got great training from great nurses who were amazing at helping me to understand things. And the first case that I did involved a younger person with children at home. And that kind of broke my heart, seeing someone in my age group with little children at home. And I didn't know if I could be a good nurse and keep my emotions in check. Because I have had to learn that it's okay to feel what you feel. It's okay for you to grieve that loss too, but ultimately, when you're a hospice nurse, the patient's death is not about you. It's not about your emotions, and you're there to be supportive and give the patient and their family what they need through the process. So you can't let your emotions take over. And I'm an emotional person. I'm a very sensitive, caring, compassionate person, and it was very hard for me in the beginning to see younger people at their end of journey. You know, um, I still get a little emotional, and I still sometimes come home and feel um, a little heartbroken when some people die. I think I think it's hard to learn when to be quiet and just offer your support, and when to give words of support and what words to give. And I don't know if all hospice nurses have had the same experience when they start, but I have said the wrong things sometimes. I have said the things that you don't want to hear when somebody dies. And death is a part of life. It is. And it can be beautiful. Death can be an experience that doesn't have to be uncomfortable. And that's what I love about hospice. I love that you can give somebody a good quality of life up until the end. Birth is a very important part of our life's journey, and death is an equally important part of our life's journey. So I feel really honored to have a position and a role in giving that kind of nursing care. It's very, very different than long-term care, I've discovered over the years. And I don't think I would go back into long-term care as much as I did it and loved wound care and all of those things. I think what is very beautiful about hospice is that you're not pushing a medicine cart. You're not trying to rush between each patient and get your med pass done by a certain time. You learn how to schedule your patients so that you can meet their needs best. You learn what day of the week you need to put them in, and you really get to sit down and spend time with them. And if that time needs to be longer, then you oftentimes do have the ability to ask your team for help if necessary, or to reschedule the patient. You know, you have time, more time, I feel, to give your patient individualized attention and learn about your patient. And I think I like it also because it's similar to long-term care in that you get a routine. And people are a lot of times at end of life in long-term care as well. So again, I did work hand in hand with hospice in long-term care, and I have seen a lot of people at their end of their journey, and I have been a part of that end of journey in long-term care as well as hospice. And what I can tell you is that if a person is completely comfortable and surrounded by the people that they love, I have seen some really beautiful dying experiences, if you could call death beautiful. It's sad. It's sad when you lose your loved one, and it's sad when you feel like your loved one's being taken from you. And that is not an easy journey for families. They are losing their loved one, and the patients are taking that journey, their final journey in life. And so they're frightened and they have questions, and sometimes people are very accepting of that diagnosis and that disease process. But when it gets toward the end, I think everybody does have that fear of what's going to happen next. And the common theme that I have heard patients say is, I don't want to feel pain. I don't want it to hurt. And I think a common misconception that people have about hospice is that we give people medications that are ending their life. And that's just not true. We are giving medications that are making a person's symptoms manageable. The disease process is what is taking a person's life when they're in hospice. The medications that we give are giving them the comfort that they deserve at the end of their journey. And I've seen a lot of times when we're giving those medications and people aren't sleepy, they're just comfortable and they're able to participate with their family and enjoy those last days with their family, however long that may be. Because I will tell you, there's also a misconception that if you come on hospice, this is absolutely it. This is it. You're going. It's your time. But I've seen people that come onto hospice and their prognosis looks really poor, and then they kind of bounce back and they don't stay on hospice sometimes, and maybe they need to come back later. But hospice is about giving people the best quality of life that they can have at the end of life, and managing their symptoms and letting them be able to have the death that they would like to have at home with their family. Some people don't want to, pass it at home. Some people in GIP situations that I've done in the past wanted to not, their families weren't able to cope with the idea of them coming home and passing at home. And some people really do need a different type of support at end of life. And that's the beautiful thing about hospice. Another thing that people think is that hospice is a place. It's not. We do have inpatient facilities in hospice companies, and generally those inpatient facilities are meant to be for respite stays, to give the family some relief when they've been, taking care of someone night and day, and they need a little bit of a break. I mean, it's overwhelming for families to do end of life journeys, and sometimes they need to have a break. So those inpatient facilities are utilized for that, and they are used for symptom management when a symptom cannot be controlled in the home. A lot of people have the goal to have their symptoms managed at home. That is what they want. They don't want to go to a facility and die in a facility. They want to die at home with their family with them, and our goal is to try to help them accomplish that. But sometimes they do need to go into an inpatient facility for a short time to get those symptoms under control so that they can go back home. And sometimes people do not get to die at home with their family. Sometimes they do die in the facility. But I still have seen in our inpatient facilities, in the facilities that I've been a part of, I think the team of staff that's working in the family and the experience can still be very peaceful and comfortable for the patient. And a lot of times when you get into a situation where symptoms are not managed, families do need that extra help and support. But hospice is not, it's not like a nursing home. You're not just putting your loved one in there. And I don't know, like I said, I've only done hospice for about 4 years, so perhaps there is a facility that I'm not aware of, but generally what I've seen is an inpatient facility that is for short-term use. And sometimes people do go into those facilities and die because they're at that stage of their journey. But generally they're not spending their journey in those facilities. They're at home. And the beautiful thing about hospice that I really love is that you're able to change the amount of visits that you do as the patient's need increases or decreases. It's something that you're able to tweak it. Sometimes you're seeing a patient once a week. Sometimes you're seeing a patient every day. Sometimes you're seeing that patient 2 or 3 times a week. And the other thing is, in hospice, we're still treating treatable things. If a person gets a UTI, if they get a respiratory infection, if they get a wound, we're still treating those things in the home. We're still treating that person and doing preventative care during the process. I think there's a misconception that if you go on to hospice, that you're not going to get any treatment. You're just going to pass. But that is really not the case. I've given lots of education about it during my short time as a hospice nurse. And I think that we have doctors that I've always worked with, really amazing doctors who are very quick to return calls, very quick to answer calls. I feel like when you are working in hospice, you are not working face to face with each other very often, and you spend a lot of time alone in hospice, on your own, sort of. It's not the same as working in a building together and seeing the same people every day. You do see each other once a week, but I feel like the team is still very cohesive. I feel like it's a different experience with doctors than I've ever had, because in this case, I have always felt like the doctors were my colleagues, even though I knew that they had the final say about what I was going to be doing, they had the information and the training and the education to provide me with what I needed. but I have never felt like anything but a colleague. I have always felt like in long-term care, I don't remember working with a doctor that I didn't feel there was this division between doctors and nurses. And there's always been a healthy respect inside of me for doctors because I started in nursing so many years ago, and there's almost a fear. But in working with hospice, it's such a collaboration of team that you really truly feel like a team. Your CNA, your manager, your doctors, other nurses. And when you work with a good team of people, you're able to communicate with one another, troubleshoot, talk about things that have worked for other patients that maybe would work for your patient. Everybody has got different experience. And I feel like it almost feels like a family when you work with a good team, as opposed to, I think people who work together regularly sort of feel that way. I remember a girl saying to me, a CNA in long-term care said to me, we spend more time here than we do with our families, and essentially we're family. We're a family here. And I think that is true in work environments. You sort of build a family environment with each other because you are spending a lot of your time with your coworkers. And in hospice, you're not stuck in a building generally with the same people, but you have contact with all of those people, and it's beautiful to be able to phone a friend. So I have really loved my hospice experience. I'm still learning, I'm still growing, but I think I would like to help be a part of the community that dispels those myths and answers those questions that people have, because I still think, I remember when I first encountered hospice when I was very young, and it was a different thing. People were truly at end of life. I remember people coming into the home and that sort of thing, and learning about the history of hospice was really interesting. You should look into that sometime. But it's changed. It has changed, it has morphed, it has grown over time, and hospice doesn't have to mean what people, it's a taboo word. When people hear hospice, when people hear morphine, when people hear cancer, they immediately think, well, this is it. And I think that some people have the misconception that when you go on hospice, we're just there until you die. And essentially we are, but it's not like that. We are there to support you through your process, answer your questions, support your family. We have chaplains, we have social workers, there's music therapy, there's volunteers that donate their time. I feel like when you are getting hospice care, you really, really do get a lot of attention. You get a CNA to help you with your bathing. You have really immediate access to the doctor. Nurse practitioners will come into the home and see the patients. I feel like you really have access to healthcare in a way that you don't normally, because it's very individualized to the patient, and it is very patient driven, and it is, I feel like you get a lot of good attention when you're on hospice, and you get a lot of good education, and I hope that people that have been on hospice have compassionate workers and compassionate team members taking care of them, because I think that the rapport that you build with the patients and their families is another one of the benefits of working in hospice, is that you get to know your patient on a deeper level. You get to learn about maybe how they were when they were young, and you get to learn about the things that they like, and they get to eat and drink what they want. We're not there to tell them not to do the things that they love, or the things, within safe reach. Obviously, we're not going to encourage people to do unsafe things, but I feel like hospice empowers people to have the death experience that they want to have. They want to be comfortable. They want to be surrounded by friends and family. And they don't want to be going out to doctor's appointments and trying to manage all of those things. I think that if I had known that I was going to, I never dreamed I would work in hospice when I started my healthcare journey. But I wouldn't trade it for the world. And I'm very thankful for the first hospice company that hired me and gave me the opportunity to get into this very special line of work. And I'm so thankful that I get to be a part of it. And I would love to share more of my journey if you would like to know more. So if you have any questions, please feel free to share them in the comments. Please, if you want to learn more, consider liking, subscribing, and following me on this journey. We won't just talk about hospice. I have done lots of other things in my career that may be fascinating. And I hope to see you soon.